Everyone in the United States needs to have health care coverage. Everyone needs to have access to health care. It's not just a business, it is a moral responsibility and a moral obligation of a society to provide for health care for its people. And we need to understand that. All of the costs are already sunk in the system, and right now we're incenting the wrong things. We're incenting things that cause people to avoid getting health care coverage. We're incenting things that that encourage people to go into the healthcare system at its most expensive point, and it's increasing the cost. We're incenting insurance companies who are trying to avoid coverages, avoid paying for things, cherry pick the best people out of the system, and avoid paying for the serious needs that we face. And we've got to change that. It's estimated that someplace between 20 and 40% of the total health care costs in this country are transaction costs, costs that do not add to the health care between the doctor and the patient. And we need to change that. We need to provide for a system, and I support a system much like John Edwards was advocating, where there is options available for people on the private market, but there also is a government option that competes with those options and encourages them to be more efficient, to provide the kind of coverage that they need to provide, and makes affordable and available on a sliding fee basis coverage so that everyone can get into the system and everyone can be covered. Without that, all we're doing is encouraging people to go without health insurance, and the rest of us who have it are paying higher premiums as a result of it, and those people, instead of having preventative care, are going into the emergency rooms and accessing the system at its most expensive point.
Thank you, Mr. Tinklenberg. Now, Mr. Olson?
Well, first of all, I think it's immoral that all Americans do not have health care. Harry Truman, Richard Nixon promised health care for all Americans. It's way past time. We need to consider a single-payer system. We can't move there directly. I understand some of the issues. I own a pension administration company. I drafted the second employee stock ownership plan in Minnesota back in 1974. I understand the issues, and I know some of the solutions. I spent time with former Republican Senator David Durenberger discussing this issue, presented some new ideas to him that he thought were great. I spent time with our representative, who is an expert in this area. First of all, I do believe that we can't move directly to single-payer system. The way to get there is this: mandatory health insurance for all employers at the level of under 50 employees, refundable tax credits that are easily administered through deductions from the FICA and the withholding tax that the employer pays for unemployed and self-employed, vouchers to go to purchase their insurance, and very, very importantly, Medicare as an option. Medicare has 3% of its budget for administrative costs. Most insurance companies are between 20 and 30%. We give Medicare as an option to employers and individuals. It may become the competitive choice of everybody, moving us toward the single-payer system. We do not need. We might move to a single-payer system, but we do not want to move to a single supplier system.